Okay, I think we'll get started. I can see we've got about 40 participants now. So just to welcome you all, my name's Hugh Salmon. I'm the director of the Global Social Service Workforce Alliance. Apologies if there's any background noise where I am. I'm actually at the railway station in London, King's Cross, the one where Harry Potter used to catch the train to his boarding school, Hogwarts. Platform 9 3/4 is just around the corner, but I'm sorry I can't have that as my background. So I'm just going to run through a little bit about the background to this webinar, which is our second webinar during Social Service Workforce Week. And then I'll introduce the speakers. So thank you again and welcome everybody. Good morning, good afternoon, wherever you are. So just to mention that today we're releasing two guidance notes. One is proposed guidance on developing minimum social service workforce ratios, and the other is proposed guidance and a tool for costing the social service workforce. Now, just to emphasize, the reason that we're calling these proposed guidance is that we really want to work with you, all of you, 40 plus people who are with us today and others around the world. We want to work to strengthen this guidance because we've developed it based on the best research we could do on good practice in using ratios and in costing the workforce. But we really need to learn more about how this can be implemented in practice. So at the end of the webinar, I'm going to invite you to join a group where we're going to come together and develop this guidance further and make it more concrete and using real examples where you have actually in your own country worked out what should be a minimum ratio and tried to cost the workforce. But you can see the links there, these two, the proposed guidance. So the initial versions are out now. We'd like you to download and start reading them. And later on, we'll be producing translations as well, I hope. So just to say a little bit briefly about who we are, many of you may well know, if you're new, please join our alliance. We have over 3,150 members across 148 countries. We're building a social service workforce that's knowledgeable, capable, critically reflective, and committed. And our aim is to serve as a convener, just like in events today. We're bringing people together for an inclusive, representative network, which advances knowledge through critical evidence-based tools, just like the tools that we're launching today. They're evidence-based in the sense that we have looked at all the existing evidence on the use of ratios and costing, but we want to further strengthen us with the evidence that you guys will be providing when you join our interest group. Our other role is to advocate for workforce supportive policy reforms. Our members, I'm sure you're coming from many different backgrounds today, but they're generally affiliated with NGOs. They're also working in government, UN agencies, donors, academic institutions, and many others. Some of you may also be studying social work or related courses. Membership in the Alliance is free, and it brings many opportunities to engage in, support, and advocate to strengthen the social service workforce. So I'm delighted to introduce four amazing speakers today. Firstly, we're going to have a recorded message from the Director of Child Protection in the UNICEF Program Group, from Cornelius Williams. Then we're going to hear about ratios from the lead consultant in developing this paper, who is our Senior Technical Advisor at the Global Social Service Workforce Alliance, and that's Natia Patskhaladze, joining us from Tbilisi in Georgia. And then we'll hear from Shar Kurtishi, who is a costing expert and has helped, therefore, produce the costing guidance that we're going to be talking about later. And he is an expert in global public finance management and innovation, and he's a consultant on innovation and reform in that area, and also a senior associate with Mistral International. And then we're also going to be hearing from His Excellency Boros Samheng from Cambodia, and he's going to be giving some experience on their experience in Cambodia in developing workforce ratios. His Excellency Boros has a very long job title. I'll try and read it all because he's the minister attached to the Prime Minister and Secretary of State of Ministry of Social Affairs, Veterans and Youth Rehabilitation within the Royal Government of Cambodia. So we're delighted to have His Excellency Boros joining us today, sharing us some practical insights and experience in Cambodia, how they've already prepared for the use of this guidance and how it will help them further in future. Just very briefly on some webinar logistics, as with other webinars, we invite you to submit your questions through the Q&A button. So just to remind you, the chat is really, if you have a technical issue, use the chat and you can direct it to the host. But if you have a question for the panelists, please put it in the Q&A and then we can answer it more easily because we'll see it in the Q&A more easily than we can see it in the chat. And the webinar will be recorded and will be made available for you afterwards. Okay, so we're now going to hear from Cornelius Williams, and I invite Elena to play the video from Cornelius. Thank you so much.
Thank you for inviting me to speak at the launching of this guidance on ratios and costing of the social service workforce. First of all, I'd like to congratulate the organizers and everyone involved in organizing the Social Service Workforce Week. Child protection concerns, including all forms of violence, abuse, neglect, and exploitation, place a long-term burden on social services and the workforce, and undermine investment and development across all sectors. In fact, the estimated economic cost of violence against children is 7 trillion per year. But it's not only the economic cost, there is also the human rights implication. Protection of children is a right embedded in the Convention on the Rights of the Child, essentially for long-term sustainable development, growth and development, and the attainment of the Sustainable Development Goal. So, social service workforce is critical for those goals. Undeniably, one of the most important elements of any well-functioning child protection system is a qualified social service workforce. Social service workers are often the first line of response for children and families facing adverse situations. They play a critical role in identifying, preventing, and managing risk, and in responding to situations of vulnerability and harm. They provide a system of support for children and families by connecting them with critical social services, such as healthcare, education, and social protection. A well-developed social service workforce is also key to promoting social justice, reducing discrimination, challenging harmful behaviors and social norms, preventing family separation, and when necessary, supporting children in alternative care. In too many places, however, the social service workforce is not sufficiently prioritized in government spending, and the number of trained and qualified social service workers is seriously inadequate to respond effectively to critical child protection needs. This limits the quality of service delivery and case management for children and families, and undermines efforts to strengthen the child protection system in a sustainable manner. Therefore, there is an urgent need to convince government decision makers that more robust and sustained investment in social service workforce planning and development is needed, that the social services they provide should receive a larger share of the budget. This does not always require additional resource allocation, but rather a reprioritization of budgets and resources to the social service workforce to support families and communities as a key strategy to prevent rather than only respond to child protection violations and the recurrence of these violations. To make this case, however, decision makers must be motivated and equipped with compelling evidence and facts to support reform. The absence of guidance on how to calculate a minimum ratio of social service workers per population in need often hinders the ability to make this case. Furthermore, planners often lack a clear approach and tools to cost the level of investment required, including both initial investment and the ongoing cost of developing, supporting, and sustaining the workforce. To support this effort, UNICEF has collaborated with the Global Social Service Workforce Alliance to develop a guidance for policymakers in government ministries and workforce managers to develop a minimum ratio of social service workers per population and to calculate the cost of achieving and adequately resourcing that minimum ratio. Using these tools, we hope governments will be better positioned to make investment in social service workforce strengthening a higher priority, resulting in improved service delivery and case management for children and families, so that children can be better protected from violence, abuse, exploitation, and harmful practice. Investing in the social service workforce is critical to accelerating progress on all SDGs in the decade for action and leaving no one behind. I thank you.
Okay, so I'm just going to talk a little bit about the background to what Cornelius was just sharing with us. 1 second while I get this working. As he mentioned, so this draft guidance was developed through consultation meetings with a global experts group. It was also developed through a desk review, drawing evidence from health, education, and social services, and it was based on key informant interviews. We also had a series of revisions in consultation with UNICEF staff, and it was informed by work to develop global guidance on the use of minimum ratios in workforce planning that we were also carrying out in the ASEAN region, and that's the Southeast Asian Association of Southeast Asian Nations. And that was under a project supported by the East Asia Pacific region of UNICEF. So basically what's happened, just to give you the very brief background, UNICEF and ourselves, the Global Social Service Workforce Alliance, have come together to develop these two guidance papers. And the one is focused on helping policymakers in government ministries and workforce managers to determine a minimum ratio of social service workers to the population. And the other is to help them calculate the costs of achieving and adequately resourcing that minimum ratio. And you'll be hearing more about that shortly. Apologies again for my background noise. I got stuck on my way home and I had to jump into a station cafe. But I'll hand over to our much better seated experts, and we'll hand over to Natia Patskaladze now to talk about the ratios guidance. Thank you so much.
Thank you, Hugh, for this introduction. Allow me to first of all greet the attendants of this webinar and thank them for joining this webinar, as well as other events dedicated to the Social Service Workforce Week. And I specifically want to thank people who were engaged in the process of developing this guidance note. I saw some familiar names on the list. And I would like to invite others to also engage actively in finalizing this document and in using it as appropriate. So if we could move to the next slide, Alina will be helping me with that. I would like to again reiterate about the importance of adequately planning, developing and supporting the social service workforce. Because only by having a well-supported, well-trained and well-developed social service workforce, we will be able to ensure that our child protection, social protection and social welfare systems are well-resourced and well-functioning and are able to ensure the quality of services, high quality of services that we would like to deliver to different groups of our population. It was estimated that about 65% of the 169 targets underlying the Sustainable Development Goals will not be reached without effective social services and hence without the effective and well-qualified and resourced social service workforce. However, as it was already mentioned, the challenges with well-resourced social service workforce are largely because of the underinvestment in the workforce. And this is often hampered by the absence of a recommended ratio of social service workers per population. And it also is related with the lack of a clear costing tools to costing the workforce required for the population. If we could move to the next slide. We would like to tell you in few words about the experience in other sectors in using the workforce ratio as a useful tool for planning the services and for ensuring high quality of service provision to the target populations. We have a very good ample evidence from the fields of education and health sectors which suggests that the use of staffing ratios is a useful tool to inform and guide planning and delivery of the services. Different from the social sector, we have some of this, some of the related indicators reflected in SDGs, especially in education sector. So there are SDGs about the ratio of teachers per pupils already reflected in the in SDGs. We also have very extensive evidence regarding the negative effect of low workforce ratio on staff morale, on their motivation, on the increased risks of their burnout, and which results in high attrition rates, and which most importantly end up in low quality of services that we are able to provide to the population. And this is one of the most important reasons why we need to think about the adequately resourced workforce. As you are very well aware, calculating the ratio of the social service workforce is a relatively new method. However, the extensive desk review showed that healthcare and education fields are much more advanced in this direction, and hence we were able to use some of their experience and some of their recommendations while developing this document. I also want to remind all of you that currently there is no globally recommended optimal ratio of social service workforce to population or to any specific groups of population. And there is a very good reason for that, because we, of course, knew about it in advance, but these discussions and the process of developing these guidelines one more time showed us that the ratio of the social service workforce, optimal ratio, is so much context specific that it wouldn't have been right or possible from our side to suggest any recommended ratios to all countries. So what we were able to suggest through this exercise is to suggest steps which would be useful for the countries in order to come up with the context-specific ratios which will be useful for their own use. Next slide, please. What is very important to remember that workforce to population ratio should be based on the national definition of the social service workforce. And it is defined as a number of workers employed in the latest calendar year per 100,000 persons served. You can see the formula that we are using for calculating the ratio of the workforce. And I also want to remind you that the evidence suggests that this approach to planning the workforce is probably the quickest and easiest to apply and understand, and it requires much less information than using other planning tools. It is also very important to realize that we need to think about appropriate conditions for using the workforce ratios as a planning tool. And it is advised that countries which are at earlier stages of workforce development and with some capacity, but not very strong capacity of planning the workforce, are probably in the best position to use ratios as a planning tool. However, in the countries with stronger planning capacity, ratios are often not used as a separate planning tool, and they are better used in combination with other indicators. These indicators could be the workload, caseload, and many other indicators available in the field. Next slide, please. As I've mentioned, the importance of the definition of the social service workforce, I just want to remind all of you that the definition of this workforce in itself is a very complex concept, and I will not go into defining the social service workforce, as all of you are very well aware about this definition, but I wanted to share this word cloud in order to remind all of you that the titles which are included under the definition of the social service workforce are very diverse and numerous throughout the globe. And some of the titles used in some countries are particularly unique for those countries and not necessarily used in any other places. And hence determination of the workforce ratio is, as I've said, very much context specific and depends on the definition used in the country, as well as service standards and other variables existing in a particular country. Next slide, please. The document that we came up with, as was briefly already mentioned by Hugh, is geared toward the national level policymakers and planners in relevant ministries. And this could be the Ministry of Social Welfare, Finance, Planning, as well as authorities responsible for recruitment, deployment, and funding of the social service workforce at the local or subnational levels. The aim of this document is to provide step-by-step guidance with key considerations for estimating ratios, using a range of very contextualized variables, some of which are the definition of the workforce, availability of national standards on social services, and other important for the country, context-specific variables for the country. If we could move to the next slide, we will see a very quick picture or chart of some of the important country contexts, which will have to be considered and used when thinking about defining the ratio of the social service workforce in a specific country. I will not go into outlining or describing all of them, but of course, we have to remember that the decision on the optimal ratio would very much depend if the country is in development context or there is an emergency there, what is the income of the country, and some other very important indicators. Next slide, please. Starting from this slide on, I will try to quickly share with you some of the key steps that we believe everyone needs to consider if they will attempt or start thinking about defining the optimal ratio for their own use. The experience shows that before starting this process, we need to make sure that there is a strategic leadership in the country and there is an ownership of this process because without having this political support and ownership, most probably this exercise will not be effective and will not end up in the expected outcomes. The countries might need to establish or repurpose the national leadership groups, which in other words would be the groups which will be leading and advising this process and which will also be there by the end of the process in order to make sure that the findings of this exercise are well used by the government and are considered for costing and other purposes which are eventually required to strengthen the workforce. I did mention about the importance of the national definition of the social service workforce. And here again, I would like to remind you that this will very much depend on the definitions available in the national legislation. So if the country has the law on social work or other related legislation, these laws might include the definition of the social service workforce. However, in many situations, countries don't have nationally accepted definition of the social service workforce. And in those situations, it will very much depend on the active engagement of the national leadership group to come up with the working definition of the workforce, which will be used for this particular exercise. The group engaged in this process will have to identify information management systems, databases, and other information sources which will be used during the planning. Of course, it will be very important to make sure that we're using quality and reliable data in the process of defining the ratios. However, of course, the quality and the extent of the information available in different countries will be quite useful, but we will have to work with whatever we have. Next slide, please. The countries will also have to identify the current status of the social service workforce and the existing ratio of the workers to population. Of course, in the countries which have strong information management systems, the existing ratios can be identified based on those databases. However, in other countries, we might need to think about the exercise of mapping the social service workforce. And we know that many countries throughout the globe went through the similar exercise of mapping their workforce during last 5 years or so. Of course, the mapping of the workforce would require looking into a number of indicators, and some of those are included on the slide, which will eventually allow us to know much more and enough about our currently existing workforce in the country. We also need to understand about the needs of our population. And I would say that this is probably one of the most important steps or most important aspects that the working group will have to think about. Our approach will have to be rights-based, and it has to be needs-led. It is very important to make sure that our exercise is not only led by the resources available or the resources that government is willing to give up or allocate for funding the workforce. We have to make sure that we consider the specific needs of our communities. We use accurate demographic data and other indicators for understanding what our population needs before we start planning workforce for that.
Natia, sorry, we have about 1 minute and we need to move on, sorry.
Yes, yes, thanks, I know. We need to think about the standards which exist in the country related to the workforce and social services, as well as other regulation around the workforce. And also it's important to realize if these documents were developed in a participatory way and if they fully reflect the needs and services required for the population, or there is a room for improving these regulations and standards in the themselves as well. Next slide, please. The country will have to decide which group, for which group does it want to define the workforce ratio. And depending on the priorities within the country, ongoing reforms or other criteria, the country might decide to first define the ratios for general population, child population, or any other specific group most prominent or important at that stage in a specific country. We need to think about the functions and competencies of the workforce, which will be required in order to meet the standards and regulations available in the country. And all of this will have to happen before we actually start calculating the minimum ratio of workers to population or different population groups, which is actually the very last step in this very complex and important process of defining the optimal ratio for the workforce in our countries. This was a very quick overview of the steps that we thought of to suggest to the countries. I will stop here and I guess we'll have some time for discussions and more clarifications. Thank you.
Thank you so much, Natia, and deep apologies for rushing you. I know we have to be, really, we need to try and have some time for questions, and we have a couple more speakers. So thank you so much for that, Natia. And now handing over to Shar Kurtishi, who'll be talking about building on, once you have a minimum ratio, then you can use that to cost your workforce. So over to you, Shar. Thank you.
So thank you. Basically, the costing guidance overview and the key consideration will be covered by this part of this slides. So I'll be leading you through the purpose and scope of the overall guidance, the rationale, who would be the end user of the costing guidance, what are the limitations of the guidance and the tools, key considerations and steps in using the costing guidance, and also the final outcome. So why we would need, why do we need ratios and costing of social services? Because other sectors, health, education, have better basis of the evidence so that they can provide more compelling arguments for the investments, while social services are unable to compete in the same grounds, and therefore, due to lack of standards and metrics such as ratios and credible evidence, we're not able to make a compelling case. As a result, social services are underfunded and understaffed. So this leads to compromising the services and being unable to serve all the clients, and sometimes even clients have to wait longer times. For this reasons, Global Social Service Workforce Alliance and UNICEF have developed this guide to help countries booster their evidence to increase their chances for higher resource allocation for social services. Both ratios of social services and its cost will inform the annual social ministry budget request. So the ideas behind the annual budget requests that are done, both ratios and the costing of the social services as a overall would help to make it easier to convince the decision maker to allocate more resources. So not only we have X number of social workers and this is how they're deployed, but also it will help in making more efficient, more effective, and value for money, and most importantly, using the resources wisely. So who will be the end user of the costing guide and the tool itself? Basically, everyone who works in policy decision making and the workforce managers in the ministries of social welfare, the budget and planning officers both at the ministries of social welfare, but also the Ministry of Planning and Ministry of Finance, as well as different tiers of government, including the provinces, districts, counties, and its authorities, and local governments who are responsible for recruitment, deployment, and also funding, more importantly, funding the social service workforce. In addition to that, the guidance is meant also to be used by a national level leadership group, which is tasked to define the ratios and its cost. So, of course, there are limitations to the guide, and because this is the first of its kind and should be used with caution, and certainly has its limitations. So the estimated results or the outcome that are produced with the scenarios that are produced are not the budgeted cost, but rather the optimal level of the budget that you need to provide a quality and timely social service. The estimated cost produced by the tool and its variation in the cost would not fit every country. So you need to, basically you need to contextualize them and revise the parameters, knowing the fact, as Natya said earlier on, that there is different context that needs to be indexed into the process of developing and costing social services. So the costing guide cannot be used without the ratios. So before you dive into the costing, the first phase is you need to define as Natya said, the social service workforce definitions, and then define how you want to deploy, depending on the size of the country and depending on the economy and depending on several factors. You need to predefine those, but then move into also defining the preconditions for the costing as well. So preconditions to start the costing, you need to have the national leadership group who would do the ratios and the costing would need to include it in its composition a planner, a person with a planning and budgeting skills, and based on the agreed workforce definitions, namely the job descriptions, the list of the payroll list and the titles and the job groups and the professionals and paraprofessionals, and all those have to be predefined its costs. And those are different, again, from in different countries and different settings. having already collected all the data on paying and grading system within the country, having had statistics on full-time equivalent or headcount, full-time equivalent being the norm, the full-time norm, the number of hours that you do per week or per month, and headcount being the number of people working in the social services, namely the total staffing, would matter in calculations. So having predetermined the ratios based on certain agreed factors and variables and having them validated and approved, then you can start working in the costing. So the costing tool itself, there's a guidance, but there's also a tool set to it, and the tool is pretty straightforward and simple. The guide is a step-by-step kind of a tool that would help you to do the costing. So once you determine the ratios, you would need also to determine the staffing costs, the training, in-service, pre-recruitment, post-recruitment, continuous professional development, how to retain the staffing, how to motivate the staffing, and many more, such as, for instance, workstations for social workers to work, but also means of transportations and so on. So all that you can include or exclude, and that's up to a country to decide how far and where they draw the line. All of that will fall into the better budget request, or we call it a better and more compelling evidence that will support you in the future for higher allocations, which is the ultimate aim and ultimate result of where we're heading to. We would like to have more social workers. That means more financial resources need to be set aside. This will also reduce the dependency on other suppliers of the social workforce and social services in your country, and your government taking more higher proportion of the share. So depending on that, and so once you have the credible evidence and fact, then you can easier defend the proposals at the Ministry of Finance, and that's what the aim is, and that can result in higher resource allocation. So the tool itself, it uses multiple, and it's quite flexible, as I said earlier. We used hybrid solution due to the fact that we have different types of let's say staffing that can be used. So activity-based costing, the bottom-up approach, the institutional-based costing, because we have the daycares and other temporary residential institutions. Of course, unit cost-based calculations, and sometimes you also need to have reasonable allocations for some when it comes to let's say supporting training and of the workforce. The classification that the costing tool and guide uses is it uses the government fiscal information systems, so the global classifications that are used by the UN, namely by main economic categories, by line item, by classification of recurrent and ongoing, and as well as development costs. And the aim is to go into not just the annual, but also move into multiple year planning. So that would help you to, in case if you have constraints and restriction in terms of how much extra the country can pledge, the government would be able to parcel its investment in multiple years.
Sean, could you be wrapping up, please? Thank you so
Yes.
much. Yeah, 1 or 2 minutes. Thanks.
So thank you, Hugh. So all of this is in full compliance with the government planning tools and instruments, and would help to easier adopt to the plans and structures that are used in the country. Thank you. Over to you, Hugh.
Wow, gosh, I wasn't ready. You ended quicker than I expected. So thank you so much, Shah. That was really helpful. I can see we're getting some questions already. So please, the panelists, if you could have a look at the Q&A. Natia, I was a bit cheeky because I answered one that was probably more for you, but I wasn't sure if you'd have time. But if you go into answered, you might want to add an answer to the answer I already provided. But it was the question that we always expect, which is, well, where's the ratio, guys? Give us the ratio. That's what we want. And I'm afraid we're going to disappoint you because we're not here to provide you with a magic number. Unfortunately, a magic number, however tempting it might be, will not solve your problems because every country is different. Every context needs to be assessed to work out what's the number that you need for your population, given the kind of workforce that you need, given the other services available. So we'll talk a little bit now with His Excellency Boros Samheng from Cambodia, just to really find out a little bit about what kind of examples, what kind of examples and how are they going about that in Cambodia. But then there will be a chance for our colleagues to answer further questions at the end. Okay, so I'd like to bring in my colleague right now, if that's okay. So firstly, Your Excellency Boros, if you could just tell us a little bit about the background to your efforts in Cambodia. So could you describe your social service workforce strengthening and development efforts that have led towards estimating minimum ratios in Cambodia? That would be great to hear from you. Thanks, over to you.
Thanks so much, Hugh. I think Cambodia, we have been working on social workforce strengthening for quite some time now. Initially, I think we focused on developing a business case for professionalizing and growing the workforce. I think what we started was, we did a study on Cambodian situation was, we realized that our population was we have about 1 to 10,000, one social worker to 10,000 people. Yeah, we found it was really, it's not a number that we wanted to get to, so we want to start working on that. So this is include an estimated number of social workforce required at a different level of all government, from commune, district, province, and national level. Built on this, Cambodia also developed a national strategic plan on social workforce. And in this plan, we recognize the importance of having a sufficient and high quality workforce that is not overstressed and burnout. And for that, we need an optimal ratio that is conducive for the needed population. The type of work, the need of workforce, and which is affordable, being in line with the fiscal space in Cambodia. And the business case estimate that we need at least 4,500 social service workers to be recruited into the workforce in Cambodia. And the Cambodian population is roughly around 15 million people. This is based on worker population ratio of 1 worker to 3,500. And this further broken down based on how country divided administratively. And this number was estimated based on the global and regional average as well, as a factor in Cambodian current workforce, country need, and budgetary situation. And we have also factored the need to integrate this as a part of civil service reform at district level. For example, it's about professionalizing the current workforce and equipping them and with new skill at province level. We have introduced a new graduate social worker. And through this strategic plan, we now have standard curriculum and training module at different level to build the capacity for workforce to serve the population. And when we did this ratio, what we also looked at was the regional context, rather, how does Cambodia fit in? And what we also found was the highest ratio per social worker was 1 to 500 in the US, of course, but in our region is roughly around 1 to 3,000. So this is what we target, and that's what we are working on Hugh.
Thank you so much. So it's interesting to hear that there are different ratios for different countries. It can be very high in some countries, but that's not realistic in others. It's also interesting that you can calculate it as 1 worker to a size of population, or you can calculate it the number of workers to a slice of population, like 100,000 children or 100,000 population. And you'll see in the guidance that Natia was talking about, we talk about both, but more commonly to compare one country with the other, they often talk about the number per unit of population. But the other way is one per population, one worker per how many population. So you've talked about both, which is great. So my next question is really looking to the future. Now that this guidance is available, and I know that you've already been benefiting from the regional guidance that we've been developing in your region, how do you think the guidance will help you in future, in your future workforce planning and development?
Yeah, thanks to Global Service Workforce Alliance and UNICEF team that have been helping us on developing the ASEAN regional guidance. And this guidance is so fit perfectly. What we have done so far is just the first step. I think we now use the guidance to help us better plan our workforce need into the future and to analyze what extent of the current ratio are sufficient in our context. For this, we need to analyze the level of needs, like what Natsha was talking about earlier, the number of people in needs of child protection and social protection. And I think the new guidance will be very useful for all countries like our to standardize the workforce number as well as to professionalize the sector. This document will also help us in advocacy across government, especially with Ministry of Economic Finance, where they are the decision maker for our budget. Pretty much in this sector, in other sector, the need of social service workforce is not so well recognized. And I think Shah was talking about just earlier that there is not yet a definition, the need, and we cannot be, because the other sector like medical sector, doctor, lawyer, I think they can be redefined as a need for their profession. Social service worker, it's not being recognized. In my country, it's tough. We have to do a campaign for students just to go to school to actually become a social worker. So this is a lot of advocacy need to be done. So what we need is to develop guidance such as this to define and define the need for the social worker in our sector, and something where they can best meet the needs of our population. And I think today I will also thank UNICEF and Global Service Workforce Alliance that established this global alliance, the global guidance. Thank you.
Thank you so much. And it's great to hear how you're using it already, but how you could use it further for your advocacy efforts. Because I certainly agree from what you said, Your Excellency, in Cambodia, that it's a big challenge to continue to persuade our partners in other ministries, particularly the Ministry of Finance, but also in donors, that we do have the basis to develop the workforce. It's not just guesswork. Sometimes they say you can easily count the number of teachers you need for a certain school, the number of doctors and nurses for a certain hospital, but it's very difficult to calculate the number of social service workers. And we're saying, no, it's not. There is a basis for doing that. And there's a basis for costing, which is why we have the guidance today. It's so great to hear you're using it, and we'd like to hear from others who are using it or will be using it. So we have some Q&A. I don't know if hopefully some of them have been answered already. But I don't know whether I could just direct a couple of questions just briefly to Shah. Firstly, the question of minimum wage. So do you know any examples of minimum wages for the social service workforce? And what are the roles governments play in setting a kind of minimum pay? Is that something that you experienced, or is it too difficult to generalize on that? Maybe you have a view on that, Shah. And then Natia, I'll ask Joe's question to you after that, if that's okay. Thank you.
Hugh, I'm not sure I'm able to answer that because it's too broad, kind of, because different countries, as I said, they use different paying and grading systems. Therefore, the same goes for the salaries, which means that they vary quite a lot from developed countries to the one being under development countries, and especially when you top it up with emergency context and so on. So I don't think there are minimum wages that are used across the globe, and there are median wages, and those are used under UN example, but I don't think those should be the basis for the calculations.
Right. Okay. So we need to tread carefully, clearly. Yeah. Just another question for you, Shah. Sorry. So from Joanna Rogers, you can see What about the advice on transport and communication costs? Do you think that should be folded into the salary, or is that a problem because it's then seen as part of the income and then it will be taxed? And any view on that?
Yes. So basically, I think the salaries should be brutto salaries, including all the taxes and everything. But then you might need to top it up when you do your budget request. You might need, if you hire additional 100 social workers, of course they would need means of communication, means of transportation, and means of to work. So basically, workstations and some basic equipment. This is, however, those that are in place, they might have already those equipment. So all of that needs to be, when you do the variants or the scenarios, I think those should be taken in consideration. We know, for instance, in a country how many social workers you have, and we know with using the ratios how much they would be allocated from the ratios. So the difference from the two would give you basically the need for additional resources, and that's the basis for additional kind of the starting point where you do the extra budget request.
Okay. Thank you so much. I'm glad to hear that. I'm very passionate about making sure that social service workers have money for transport or a vehicle, because so often they have a basic salary, but they have nothing to enable them to do home visits. And without doing home visits, they can't be a social worker or social service worker. So clearly all those aspects need to be costed and not just rolled into a salary and then possibly overlooked. But just turning to ratios now, if that's okay. So interesting observation from Juliet in Uganda. I think that Juliet's comment is actually talking about caseload as opposed to ratio, because you mentioned a global average of 1 to 25. I assume that's 25 cases per caseworker, which might be roughly speaking a target for many countries. And you've mentioned that in Uganda, it's about 116 per caseworker, which I probably recognize also from my work in Uganda. So that is clearly a challenge, and therefore shows the need for more resources. And as the guidance that you'll see does talk about caseloads as another way of determining the size of the workforce. But Natia, over to you. Do you want to address a couple of those questions about whether we can use benchmarking from other countries as an observation from Joe, which we would certainly agree with, but some of the other questions as well, maybe you'd like to tackle. Over to you.
Yeah, I've started responding to Joe's email in writing, and I was saying that the document includes examples from different sectors, as well as social protection and justice sectors from different countries. However, as Hugh has just mentioned, of course, we are not suggesting these examples as kind of examples to be copied and used by other countries, because they are so context specific. Also, there were some very good examples and discussions shared by yourself, Joe, as well as other members of this working group on the approaches which are used in different countries in trying to define the ratios for the social service workforce for different usage of the services or different usage of the social service system, meaning that there could be different scenarios defined or estimated by the countries. For example, imagining the situation that countries are able or willing or only to at some stage to address the most urgent, compelling needs of the specific groups of the population. And for that, they might be calculating one set of minimum ratios. And they could also think about the situations when, for example, there might be emergencies or there might be increased demand or use of certain services. And for those situations, countries, and also they might also be having kind of more ambitious vision at that point in the country for addressing the needs of their population. And for those situations, they might be also calculating different set of ratios. So just to summarize, the document includes some examples, but because the definitions used behind these examples are so very different, most probably it would be really difficult for other countries to apply those numbers for their own use.
Thank you so much, Natia. And I think the other questions will have to be answered through the working group, which I will mention in a minute. But I just want to have a quick go at answering Vishanti's question. Thank you so much for that question, Vishanti. And I think we would absolutely agree that this is not about trying to make cuts and trim down the workforce to a bare minimum, which some people say is very much the agenda of new public management. This is actually not about dumbing down or deprofessionalizing. This is actually using a needs-based and rights-based approach to say, in order to meet children's needs and the needs and to fulfill the rights of the populations who need these kind of services, what level of workers are needed to fulfill those rights properly and adequately? And at what level do we need professional workers as well as paraprofessional workers? So really, this is an advocacy tool to make sure that the workforce is adequately resourced. It's not giving an excuse to planners to cut away at essential services, quite the opposite. But I do understand that if you give too simplistic numbers to certain people, they might use it as an excuse to cut away. Natia, did you want to come in on that one briefly? You're muted.
Yeah, I just saw this question as well, and just to add a few more words to what you've mentioned. Of course, we didn't have time to go into details, but I did mention our intention to make sure that the needs of the population and the way of defining the needs of the population is very much rights-based and needs-led, and it's not only, the ratios are not only defined based on the standards or laws which could be developed in isolation and not through participatory manner and not through at all assessing the needs of the population. So I think we've tried to make it very intentional. And also in the document, we are suggesting that it would be useful to define the ratios for professional workforce groups separately, because we're also acknowledging the importance that for implementing certain functions in the system, we need very well qualified professional social workers who will also be able to supervise the workers who have lower qualifications, who are paraprofessionals or even volunteers. And I think that's also to some extent some kind of advocacy suggestion, because we cannot have functional systems without having adequate number of qualified staff, even though we need paraprofessionals as well in many instances. Thanks.
Thank you. Thank you so much, Natia. So like a good radio host, 1 minute before the news, I'd like Shah to have 20 seconds because your hand was up, Shah. Can you give a final remark in 20 seconds and then I'll wrap up with the remarks on the slide. Please go ahead, Shah.
Yes, just wanted to go back to the number of cases versus social workers. Those are used in absence of ratios. So ratios are used in health, widely in education, in justice, but not in social services. So in absence of ratios have pushed countries to use the ratios social worker against the number of cases. And the fact that social cases can vary from a few minutes of consultations to a 2-year lengthy case, that's the difference between other sectors and social sector, which makes it more complex. So ratios would be the right choice to have proper resource allocation, especially when it comes to staffing. Thank you.
Absolutely, excellent. And obviously cases are about the known cases that come to your attention, whereas ratios is about the unknown, about the needs that may be out there in the population. What workforce do you need to meet all those needs, not just the cases that come across your desk and defining what kind of caseload you can cope with. It's about what kind of service the population needs. So thank you so much for all our panelists, for our speakers, to Shah, to Natia, and for His Excellency Boros Samheng from Cambodia. We've had a really wide range of insights. And I just want to close by encouraging you to download the guidance papers. If you go to our website and then click on resources and then Alliance resources, you can see both links there, and you've seen the links in the chat as well, I hope. And if you're involved in this kind of work, please volunteer to join our future interest group. We're setting up an interest group that will work together actively online to improve this guidance and add concrete examples from your experience. A survey will pop up at the end, and you can mention your interest in that survey, or you can email us at that email address. Finally, please fill out that survey at the end to say how useful this webinar was. And also, please take time to read the guidance, and even better, to read and use the guidance And then you can fill in a feedback form on how useful it was. You could immediately say there are gaps here, there are things needing to improve, and you can put that in your feedback. Or you can start to put feedback once you're using it. We would welcome all that feedback from you, because this is very much a joint endeavor, and we're just at the beginning stage. Having produced the initial guidance, we now really want to work together to improve it, because then it'll have much more impact in achieving the ends that we want to achieve in improving services worldwide and strengthening the workforce worldwide in all your countries too. So thanks everybody, it's been a wonderful event. Sorry that we rushed a little bit, but I think we covered a lot of ground. Sorry again for my railway station background, but at least I was able to speak to you all. So thank you so much, all the best.
Thank you.
Thanks, everyone. Have a good day.
Have a good day, everyone. Goodbye.
Goodbye, Boris.